There are both pharmacological and non-pharmacological interventions available. As nurses, we want to use the least invasive first. First, we want to identify and treat the underlying acute illness. We also need to establish a baseline for the patient. Ask the family what changes they have noted with the patient. It is also important to avoid moving the patient, as this would likely cause more confusion. We need to promote sleep in these patients. An example of this would be keeping the noise down at the nurse's station at night, as well as clustering nursing activities to help minimize interruptions. We need to monitor patients' physiological issues, such as hydration status and how they are breathing. We need to encourage mobilization in these patients. We need to make sure their pain is under control, and we need to make sure they're maintaining an adequate nutritional status. We also can use a safety sitter, and physical restraints are considered the last resort.